It feels like an age since coronavirus became a big issue for our intensive care units.
We'd had staff from our other departments within critical care observing, getting experience and training before actually the first patient hit us. But then the pace of patients coming through the door rapidly accelerated. As the numbers increased, we were deploying in staff from other departments.
I had just come back from Samoa in the Pacific, supporting the healthcare systems there with the measles outbreak, and then I was asked to redeploy back to critical care. So I'm lucky, I'm a critical care nurse. A lot of these staff members, they've never worked in a critical care unit.
We've had theatres, scrub staff, recovery staff, anaesthetic staff, ward nurses, even dental nurses. Everyone's played a part to support the critical care nurses in delivering the standard of care we're aspiring to.
Being in chaplaincy, I think I'm in a very privileged position to be with families at a time when they are most in need. But during Covid-19, the families are not allowed to be by the bedside. So we've done a lot of video calls, and it's been rewarding for families despite their traumatic experience.
A lot of our staff wish people would stop telling us how many people had died, but how many people have survived.
Stacey was in ICU on life support for around a week, and it's that every day of ringing but not wanting to ring, but you're desperate for the news about your loved one. I was told she wasn't going to make it and I should call the kids to say goodbye. Then the doctor said that there is one thing left they can do, which was proning, and how dangerous that is. Tuesday night, the phone rang, and you're dreading those first words, but it was good news.
Patients' recovery can be very, very slow, but there are moments that really do bring some joy for the staff looking after them. So, for example, the first time somebody starts to wake up.
For their family member to hear them, say the words "I love you" to them, everything that we're doing is for moments like that.
One of the things that we're very much looking forward to is meeting their families at the critical care follow-up service and having a chance to explain what's happened to them and their loved ones.
Thank you. It's not enough, but thank you. You're risking your life as well in these strange times.
Well, today I have been at home awaiting my COVID-19 test result because my wife has been symptomatic and unfortunately has come back positive for both of us. So we are both COVID-19 positive.
To say I've been terrified of giving the virus to other people if I had it is an understatement. I have kept away from obviously family and friends. My period of exercise I've forfeited several times because I didn't want to go out with the amount of people out on the streets.
Many people, including myself, are staying away from home when we're doing a group of shifts. So, for example, the 3 night shifts I've just done. We're now all wearing enhanced PPE. I think it's made some of the communication much more challenging.
A more senior nurse said, that I can't even see if a band 5 staff nurse is crying through her PPE.
We've always understood from the very beginning that this was not a blizzard, it was not a storm, it was going to be a winter. You can run on adrenaline only so long, but there is a point where everybody's human and everybody can crash or feel down, feel low.
Staff haven't got this normal support network that we're used to. So, they go home to an empty flat or they go to this hotel room that is empty and they haven't got necessarily people they can talk to face to face.
So a lot of people were reporting that they weren't sleeping and their minds working over and over.
The trust has stepped up. Every day when I look at the staff briefing, there's something there around staff wellbeing.
I've been helping the site leads to get their wellbeing hubs up and running, and these are areas where staff can go and just take some time out for themselves. We've got 60 people in the trust who've got a coach now who wouldn't have had one previously.
We have tried to talk about feelings and emotions and normalize that it is normal to not be okay. It's completely normal to feel grief and to feel sadness and some anxiety and some fear.
So our clinical psychologists, who normally are patient-facing, have directed themselves to our staff to do some psychological first aid.
It's very easy to lose sight of what's happening out there in the real world if you're just constantly surrounded by just the healthcare aspects of it.
The one big thing for me that always puts a smile on my face is when we receive a picture from one of the children in the local community.
A short message from a child that we put in our staff chill out room. I suppose what it's helping to do is to remind people that there's a lot of good out there.
We've had the most amazing amounts of donations come to the Trust.
It's been truly inspiring to see that connection between the NHS and the public and the NHS.
I did spend the first week actually on my couch, just quite depressed, not knowing what to do. I mean, I wanted to play a small role in helping out during this time. That's when I decided to apply for a job as a cleaner in Whipps Cross. And then I accidentally went viral after I posted a picture of myself on Twitter. I'm proud that I'm cleaning in the morning and raising money for charities that are dear to my heart in the evening.
What COVID-19 has done is brought communities together. It's brought different organizations together. And I do hope this spirit of collaboration continues.
We've proved through this period of time we can really do things at pace and make a real difference to our staff's experience.
It has been truly remarkable to see our ingenuity, tenacity and bravery and courage around.
I think it's important to remember that I think these things are not forever, that we will beat this virus. I work in the maternity unit and you can see that there is hope. You can see that life will go on and you see it in the eyes of a baby.